The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Piermatti. Dr. Piermatti, welcome to the program.
Thank you, Randy. Nice to be here.
Now, we've said you're an expert on the topic. You're board certified in two things, dental implantology and prosthodontist. What is a prosthodontist, by the way?
Well, prosthodontics is one specialty. There's 9 specialties of dentistry, and prosthodontics is one of them. It's specifically implant, aesthetic, and reconstructive dentistry.
Okay.
Implantology is a discipline which interfaces with that specialty, but is one of the disciplines within the specialty of prosthodontics.
All right, now your center, you do both. I mean, under one roof, you do the surgery.
Correct.
You personally, and then also you do the restorative part.
Correct. I practice at the New Jersey Center for Implant Dentistry. It's a group practice where there are multiple specialists, and my entire activity centers around dental implant reconstruction. I do both the surgical placement of dental implants as well as the final restoration, or in other words, the fabrication of the prosthetic teeth.
You've done, over 12,000 dental implants.
Correct.
Is there a steep learning curve with this surgery?
There is. When I first started back in the early 80s, it was difficult for me, and the technology at the time was not what it is today. Now, after all these thousands of implants placed and restored, it's now a very predictable restoration.
So what are the different categories of dental implant patients that you see?
Our facility sees a great deal of very complex cases where patients feel as though they are at a lost cause, and they really are searching for an answer to their dental problems. They might have had.
When you say lost cause, what do you mean? Like their mouth is a mess?
Sure. They might have had a lifetime of dentistry. They might have had they now have a lot of failed dentistry, and they're looking at the prospects of the removal of most, if not all, of their natural teeth, and they really don't like the prospects of complete dentures.
So the question is dentures or dental implants. Can your gums be too bad, though?
Not
for
really.
Dental implants?
Not really. If a patient is suffering from severe periodontal disease, or if they have carious or decayed teeth that are non-restorable, those teeth can be removed, and now you're placing implants into good, clean, healthy bone.
So the disease goes away when you remove the teeth?
That's right. The periodontal disease goes away when the periodontally involved teeth are removed. Another category would be patients who are simply missing one tooth. They might have had that tooth extracted from dental caries or decay, or it might have been congenitally missing.
All right.
Then there might be a patient that might be missing 2 or 3 teeth and simply want to have the replacement of those teeth rather than a removable partial denture.
Okay.
That patient can have dental implants, certainly. Then you have the denture wearer. They might be a recent denture wearer. They have had their teeth removed relatively recently, have had dentures inserted.
Because of the internet, by the way, are these denture wearers, they know about implants, they're going, boy, maybe I should have got implants?
That's right, and they feel as though they've made a mistake. They had their teeth removed thinking they didn't want to do the dentistry necessary to save those teeth. They've now gone to dentures and they feel as though it was a mistake. And they can easily reverse that mistake simply by placing implants and restoring with fixed, or in other words, non-removable teeth.
Now, what about somebody in dentures 30 years?
And then you have the person, correct, and then you have the person who's been in dentures for a number of years.
But don't they, haven't they lost too much bone at that point?
They do lose bone. However, they still can have implants placed oftentimes.
Okay.
We can place implants, create fixed teeth for them, or we can place implants and do something a lot more conservative to make that removable denture a lot more stable and comfortable.
What about your oldest patient? How old's your oldest patient that you've done?
We've done people in their 80s.
Really? Now, why would somebody 80 years old want to do that?
Well, again,
it seems very painful.
Again, it's not painful. I know it seems hard to believe, but it's not a very painful procedure to place dental implants, particularly in a patient who has a healed gum or healed ridge, and they're going to place a couple of implants to stabilize their removable denture. And those are patients, for example, in their 80s, where we've stabilized dentures with dental implants.
Now, is it true, as little as 2 implants in the lower, give them something snap in, snap out?
2 implants are an excellent option. I can show you that right
Let's
here.
take a look.
This is a model which shows a lower jaw. This patient has no natural teeth, but yet we've placed 2 implants approximately in the corners here.
All right.
Those are the 2 implant abutments, or in other words, the attachments there.
They're like little snaps?
They're little snaps. There are 2 receptacles that are placed within the denture.
So that's a denture. I mean, that's a denture.
That's a complete denture.
Okay.
But instead of that denture being one in which would ride all over the place, that denture goes down.
Let me feel. Is
and
this
snaps in
accurate?
place.
How? So is this about how tight it could be?
Absolutely.
Is that right?
That's how that will be.
Seems like
And
very snug.
very snug, gives the patient all that security. It's
2.
just 2 implants. It's an extremely simple
How soon
procedure.
can they get teeth in an ideal situation?
They can have teeth in approximately 8 weeks from
8
the time
weeks.
the implants are
But
placed.
in the meantime, they get something.
In the meantime, they can usually wear their denture that they've had. Certainly, they can
All
wear
right.
their denture during that healing period. We can load them a little earlier than that, but if you want to be very conservative, 8 weeks is fine, and you can begin loading the patient with the attachments.
Now, okay, well, let's back up just a moment. The people missing 1 tooth.
Mm-hmm.
Why a dental implant for 1 tooth, and what does traditional dentistry offer, and why is dental implants, why are they better?
Dental implants oftentimes are a better option for a patient missing 1 tooth. You don't have to touch the adjacent teeth, for example, if you're going to replace that one. Traditionally, we would prepare or trim down the adjacent teeth to accept caps, and then the replacement tooth would be attached to that. So it would be a 3 units of crowns. The cap on the 1 tooth, the cap on the other tooth, and the replacement cap attached to the other tooth.
All right, okay, so with a dental implant, you just give them their teeth back.
Dental implants, you place 1 implant, you put a cap on that implant, and you don't touch any of the adjacent
Okay,
teeth.
did some research. About 17 million people are wearing either an upper or lower denture.
Yes.
Does it, is your thought it starts somewhere? I mean, missing 1 tooth. Is there a bit of a snowball? I mean, is that 1 tooth? Is there any science to show that creates maybe future?
It can, particularly in the back of the mouth, when you begin losing 1, 2 teeth, you start to get some collapse of the bite. Periodontal disease oftentimes comes into play.
So to those people, get dental implants, stop the process.
Absolutely. It'll stop the process and preserve their bite, preserve no shifting of the adjacent teeth.
Okay, these complex cases, I know you brought some pictures. You say you're changing people's lives with dental implants.
These dental implants, is particularly in our center where we're doing large, complex cases, these are life-changing events.
Let's take a look. What are we looking at here?
Well, first patient that you see here is a relatively young man, just had his remaining upper teeth removed with a full upper denture fabricated. He wears a lower partial denture clasping a couple of non-restorable teeth on the lower. Very, very dissatisfied. He can't eat, he can't smile. It affects his life now. 3 times a day he wants to eat and he's uncomfortable.
So he got the denture and just didn't like it.
Doesn't want it at all. So he came to see me, and this was only a couple of months after he had the denture. So the first thing that we did was to set...
What does he say, by the way, on that consult?
He says, I want real teeth. I want to be able to bite into a sandwich, and I can't do any of that with these plastic teeth. So now we see this same individual with permanent jawbone-anchored teeth that he can bite into anything. He's smiling all the time. He's a completely different individual.
Do you see them change in personality?
We see it all the time because not only do we do the surgery, but we do the restorative. In other words, we deliver the teeth as well. So we see that emotion pouring out when the patient gets their new teeth
Can it be
delivered.
emotional for these?
Very emotional. This is
Tell me
emotional.
this. Is this true? This is the way it's done normally, okay? They go to one place for the consult.
Yes.
Maybe one day, and then they go somewhere else for the imaging, another place.
Yes.
And then they go to another place for
They'll have the surgery done somewhere
And then
else.
they go back to the other place.
Correct.
And you do it under one roof.
In our facility-
Is that rare, by the way, or is that the future? I mean, is that what's happening?
I can't imagine practicing any other way, but it's not that conventional to have it done all in one, all under one
Because
roof.
people don't like going to the dentist, right?
Nobody
Do you
likes
hear
going. Nobody wants to be there. Nobody wants to take time out of their busy
But
schedule.
do you hear that? I mean,
all
do
the
people
time.
actually tell you? I mean, how do they say it?
They really don't want to be here, but they know it's a necessary evil.
All right, okay. And you're saying this isn't painful. I mean, look, obviously there's got to be some pain, but this patient doesn't complain about pain?
No, this patient, we placed all of his upper implants. In one visit, he wears his denture the same as he was before. While things heal, same implants placed on the lower. He can wear a lower denture. We'll allow that to heal. And then we do all of the procedures shortly thereafter to give him a full upper and full lower set of teeth. Next case, I like this gentleman very much, about the same age, between 55 and 60 years old. This gentleman presents very, very dissatisfied with this. He doesn't smile. He holds his hand up in front of his face. He's unable to chew his food effectively. He cannot socialize as well as he should.
How does that happen, by the way? I mean, is that rare? It's got to be rare.
It's a lot more common than you might think. These are patients that are walking around, although that you might not notice this, but we see this all the time because this is the patient that presents to our office.
They just don't smile.
They don't smile. They're very unhappy. They want something done. They want it done as soon as possible. Okay. So what we did was we do the diagnosis, we do the treatment planning. This patient is wearing a removable partial denture. They've got broken teeth and so forth. We're then going to bring that patient from where he is to this. And this is implants. This is implants and some crowns on some natural teeth.
So they don't come out. These are
all implants on the top. They are implants with some natural teeth still remaining on the bottom. This patient can eat anything. This is an age-appropriate treatment in terms of shading of the teeth. We don't give him as bright white. He wants it to blend in with his face and so forth. And it turns out to be an outstanding result.
Is this one of those things where they say, doctor, I should have done this years ago?
Absolutely.
Really?
You hear that a lot also. And the reason for it is because by the time they're all finished and they find that this really was not that bad to have done, and now the benefit that they have, they say, certainly I should have done it many years ago.
If it's as good as you say it is, for denture wearers or even people their mouth is a mess, why aren't they all doing it?
A lot of people are really not aware of what can be done. They feel as though they are either beyond sophisticated treatment, they feel as though it can't be done for them, or they just don't know where to go, they don't know what to do.
That's surprising to me. I mean, do they tell you that? They just say, I didn't know.
Sure. People will come in and say, now I know that this is a problem, and I know, but I want you to tell me, is there anything that can be done? And the case is really not that difficult.
Really? Okay, so what's next? What else do you have?
Well, again, the same situation. This is a patient who presents. She had a few natural teeth remaining.
What is that? Am I looking at the
What you're looking at is her upper jaw. She has a few remaining teeth that were holding fixed bridge work. So she was always used to having teeth that did not come in and out. The crowns break off now, and she has to have the remaining teeth removed. So we made for her full upper implant restoration, again, age appropriate for the patient.
When you say that, meaning it's not blistering white?
It's not. This is, she wanted it to blend in with the rest of her mouth, and that's exactly what we did.
So those are porcelain?
These are porcelain to gold crowns. Let me show you this next case.
All right.
Very, very, actually handsome man. This is a very good-looking older man, but his teeth, number one, are in poor position, and they are now non-restorable.
And that is also common, you say?
Again, more common than most people would think, but we see this type of case routinely. You can see the position of the teeth. When he was a young man, he had a very toothy smile, and it would be something that would look good if all the teeth were very nice.
So he just didn't smile ever, obviously.
Now he's not smiling, correct.
Is it hard to get somebody like this? Because this is almost a disability at this point. I guess he just doesn't smile ever.
He doesn't smile, which impacts his professional life. He's unable to smile at work. He's unable to smile in his social activities. He really is undergoing a disability.
All right, so with him, those teeth had to go. What'd you do?
Take out the teeth, place dental implants, and here's his new smile.
Very nice.
And this person now, he has a new lease on life. Not only is his function or chewing efficiency significantly improved, but he can now smile. He can go through his professional life with a great deal of confidence.
Do they tell you that people react to them differently, things like that?
As a matter of fact, this person, since he had such a difficult time smiling for so long, he's still not in a full smile here.
Doesn't know how to smile here.
Doesn't know yet, but he will.
Right. We're going to take a quick break and more about what to expect on day one, the dental implant process.
Okay.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. What you need to know about dental implants. We'll be right back.
Now an important word about how titanium dental implants can change your life.
I look and feel great. My life is better.
Titanium Dental Implants from Dental Arts of South Jersey.
Dr. Piermatti and his staff were incredible.
World-class specialists providing titanium dental implants and reconstructive dentistry, making lives better.
Best decision I ever made.
Dental Arts of South Jersey. Call 856-783-5777 or visit titaniumdentalimplants.com.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. We're here with Dr. Piermatti, and we're talking about dental implants. So the big changes, just as a recap, I guess dental implants, it's rare now that you have to take bone from the hip and things like that.
It is, particularly when you look at some of the technology that we have. We can do much more targeted implant surgery where we can place implants, again, like we said, virtually on the computer. We can see all of the oral landmarks. We can see the vital structures. And now we can, with computerized tomography, we can miss all of those vital structures, and we don't have to just place implants freehand as much anymore.
Now, is it true? You say there's, less cutting. Sometimes no stitches.
Sometimes you
How
can
does that
place-
happen? How does that happen?
Well, the way that works is you do a CAT scan of the jaw first. We have that machine in our office. We take the CAT scan, we can fabricate templates, and oftentimes the implant can be placed right through the gum. It's not necessary to make incisions and flap the gum away from bone and so forth. You can put the implant directly through the soft tissue by means of this computerized.
And it doesn't hurt.
That's again much less painful if you're doing that procedure.
Do they get ibuprofen? Some people get pain medication.
Well, we give them anything they need, but some people claim they don't need pain medication, and a lot of people come back and say they really didn't take any of the pain medication.
How soon can they eat, by the way?
Well, again, it depends on what's
Let's say a
being
denture wear.
done.
Denture wear comes in. You're doing one of your procedures. Now you've placed the teeth on there. How soon can they eat?
Well, if we do a case where we're going to do what we call an immediate load, where we'll place implants and deliver a provisional prosthesis, which is secured to the implants, they can eat that evening.
Really?
Absolutely.
Soft food, though, right?
Soft foods, but they can eat that evening with those new teeth that are supported by the dental implants.
What are the frequently asked questions? Okay, so somebody goes in, whether they're a denture wear or their mouth is a mess. What do they want to know? I mean, what comes up every time on a consult? Let's say the denture wear.
Well, the denture wearer, if they're looking for something very conservative, they may say, can you help me to secure my removable denture? They might not necessarily want to be involved in a major restoration. They might just want something very conservative.
Let's go over those options. Okay, so conservative for the denture wear, 2 dental implants?
2 dental implants, very simple, quick procedure, and it can change their whole function with their dentures.
If there was a try-in period for a denture wear, okay?
Yeah.
Do you think they could go back? They come in on Friday, and if there was such a thing.
If they could have it for the weekend, they would never want to return.
Really? Is that right?
That's for sure.
Now, do you think there's a happy denture wearer out there?
Well, certainly,
my father, for example, says, he's had dentures. He goes, mine are pretty good.
Certainly there are people who feel they eat, and they do. They eat everything with their dentures and they're comfortable. But there's a large segment of the population who really can't function well with it.
And I've been told, I don't know if it's true or not, that if you have an upper and lower denture, you're not really chewing your meat. You're not really tearing and cutting. It's like a cow. You're rubbing it together. Is there truth to that?
The amount of masticatory function that you get with complete upper and lower dentures is probably 20% of what that patient had with their natural teeth.
Okay, are there people that self-diagnose and say, I'm just too old?
There's a lot of people that feel
it.
that they have the answer. They say, no, I'm too complicated. And we see those patients. We see patients who say, I think I'm too complicated. My wife told me to come in, just have you take a look and so forth. And it's like...
Just to get the wife off their back.
And oftentimes the case is really not a difficult case, and they end up with a changed life.
What about misconceptions out there that people have, the patients have about dental implants that aren't true?
Well, a lot of people feel as though implants may or may not be successful, and that's just a myth.
They'll fall out.
They'll fall out. They won't be bonded effectively to bone. That's really just not true.
So with computer imaging and things like that, I mean, if you decide to move forward with the case, chances are it's going to work out.
Very good. It's going to be successful.
Okay.
I mean, it's over 98%. There's really nothing else that we can do in dentistry that carries that type of success rate.
Okay, so the people like, in New Jersey, there's got to be thousands, more than 10,000 people wearing dentures.
Sure.
Okay. If it's as good, and I said it before the break, but if it's as good as you say it is, why aren't they doing this?
A lot of people are just not aware of it. A lot of people just don't know that this is a modality which is an accepted procedure, that millions of people have done it and have done it successfully.
What about cost, though? Do you think people count their teeth? Because you're saying 2 dental implants could give something.
A lot of people do
out.
feel as though it's going to be cost prohibitive, but it really turns out to not be as costly as they think. And people have dental restoration done all the time. And it's really not a tremendous expense when you consider conventional dentistry.
What about when you catch people early? I mean, with all that people do to save teeth, with root canal after a root canal, I mean, could it be cheaper just to put in a dental implant?
Well, certainly
long run?
Certainly that does come into play when you're treatment planning. When you look at patients who have carious, non-restorable, or questionable teeth, you do begin that whole paradigm shift on your treatment planning as to whether or not you're going to place dental implants or whether you're going to restore the teeth. Financially and economically, it comes out to be about the same, and consequently, patients are oftentimes choosing dental implants because they feel as though it is a more predictable long-term solution.
Now, you're a specialist. Does it cost more to go to a specialist? Is it about the same whether you go to a general dentist or?
No, I would say that the costs are approximately the same whether you're at a specialist or a general dentist.
Because people ask me all the time. I mean, they want referrals. They go to our website, and our site, wellnesscenter.com, is not a referral site, but I do email back, look for a specialist.
Sure.
Look for somebody, this is all they do.
Well,
right?
The general dentists, in all fairness, the general dentists have significantly come around, and I think that they are doing a great deal of single tooth replacement with implants and so forth. If you have a full mouth implant reconstruction, that's a very complex case for a general dentist to be doing.
You teach other dentists.
We do.
We didn't even mention that.
I've taught dentists for years on implant placement and implant restoration.
Okay, so for the more complex cases.
Complex cases, whether you're involved with dental implants or natural teeth, probably are restored.
Do you have a bias? Do you think they should go to a prosthodontist?
Prosthodontist
does this,
really
that focuses on this?
I think so. They have additional formal training in dental reconstruction, whether that be on dental implants or on natural teeth. Don't forget, on some of these cases, you're reconstructing the entire dentition. So specialists do that all the time.
Okay, let's take a look at that photo. This is one of those complex cases that you were talking about.
This is a complex case. This is a case
Most people, I'm sure, have never seen anything like this. I never have seen anything like this.
This is a patient where this gentleman was, as a matter of fact...
So what are we looking at there? That's that one tooth.
He has one tooth remaining. The other teeth are decayed.
And they have expanders in their mouth? Is that what's going on?
Yes, and we're able to look inside the mouth. He basically was a couch potato at this point. He really was unable to socialize a great deal. We took out all the teeth.
Did they tell you that they just don't go out?
The wife told me.
Really?
Absolutely. The wife told me that he really becomes very withdrawn.
Interesting.
Took all of his teeth out. This is how he presented before. You can see the sunken face and so forth, not smiling. And this is a full mouth implant restoration. And if you take a look now, you can see that smile. It looks very natural. He's able to bite, chew, anything he wants.
So this is one of those, the guys that probably suffered with a bad smile for
It's a very complex
10
case.
or more years.
Absolutely. It's a very complex case. Yes.
Really?
Another complex case, I'll show you one other one. This is a young girl with a complex case. She presents with what you're looking at here is the upper jaw is actually too much bone. Now, we don't see that that often.
So all those gums.
All those gums, very gummy smile
bone,
that she had when she had natural teeth. She only has a few teeth remaining and too much bone. What I had to do was cut the bone back so as to place the implants in the correct position and correct what was her orthodontic problem as well as the replacement of all of the teeth all in one shot. So you can imagine this poor young girl all these years not having a smile, having this basic deformity.
That's a tough one.
That's really a difficult situation for her to go out in public with. And we're able to now cut all of this bone back, put the implants into correct position, and subsequently put the teeth into correct position. And that's what you see in the final
Let's take a
result.
look at this. Wow. Wow, look at that before. A different person, completely different person.
Different person. Now she's, as a matter of fact, in a committed relationship. So it's a completely
So it could
person.
ignite a relationship because they're more outgoing.
Changed her entire life.
Now, in this case, I mean, she sees herself for the first time in the mirror. Were you there?
Very emotional response. Very very dramatic. She's been living this other life for so long, and now she is finally able to smile and be very happy.
So you can't be too far gone. I mean, you want more of these complex people that really just think there's nothing could be done. Their gums are too bad.
These are the cases that we really
You like
thrive
those?
on. Well, of course,
You thrive on
I
it?
thrive on those because I know when I first see that patient what a difference I can make in their life.
On the consult, do you see it and go, like when you saw this
As
gap?
soon as
you
I
said,
see it,
"Oh,
I
this is gonna
know
be
what
great."
I can do for her.
Really?
Absolutely. I
Really?
know.
Okay, time for one more.
Now here's a young woman, a very attractive woman, except for her smile. She has some natural teeth and other teeth that are going to need to be removed.
Okay.
What could be done for this woman is to prepare all the teeth, put crowns, bridge work, and that sort of conventional dentistry where you would have replacement teeth. Instead, what we did was restore some of the natural teeth and remove some of the teeth and place dental implants. Now she has all individual teeth and she has a beautiful
So
smile.
in that front smile, in that after, how many of those are dental implants?
There's 2 dental implants in there and the remaining are her natural teeth.
And now she has a world-class smile.
Now she has a smile that she can be proud
So
of.
matching up, even in the front area, the mouth, must be difficult to match up or not?
Again, it's technique sensitive is the best way I can describe it, but it's absolutely can be done if it's done with great care. You can have implant crowns to be indistinguishable from natural teeth.
Now the prosthodontist is the one that the training really is to make those teeth look natural.
That's correct.
Is that right?
That's correct.
And the proper
Prosthodontists are
position.
really what is termed the masters of the smile.
We're out of time, but as a recap, what should somebody look for then in a dentist that's going to be doing dental implants?
Well, certainly most of the people are going to be going to their family dentist, and I think that if they're going to be looking at a very complex reconstructive effort, I believe they should be seeking the services of a prosthodontist.
Okay.
If a prosthodontist is dual trained in both the reconstruction as well as implant surgery, I think they're in the right place. If
All
the
right.
prosthodontist works with a surgical specialist, they are sure to get a good result.
And at your center, all you do is the dental implants. Do they
That's
meet
correct.
with you? Do they meet with you on?
I do the consults on all the dental implant patients, and then I do a lot of the implant surgery, and I do a great deal of implant restoration, not as much. We have other prosthodontists as well that finish up the restoration of these cases.
All right. Well, thank you so much for coming on. Very interesting. Good stuff. You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.